Thank you, Mr. Chairman, and thanks to all of you for providing testimony here today. Drug pricing is the largest driver of healthcare cost in our country. We spend over $333 billion last year on drugs, of which the federal government, through Medicare, Medicaid, and the VA, spent approximately $150 billion. And while I recognize that it often takes years of research and development to bring new drugs to market, we cannot have Americans rationing or abandoning life-saving medication due to the bureaucracy, inefficiencies, and greed. Patients can't reap the benefits of pharmaceutical innovation if they're forced to choose between their drugs or rent. And hardworking Americans shouldn't pay the highest price for health care in the world and receive, for some, inadequate care at best. But like most things in life, the reality of drug prices is always more complicated than the sound bites we hear. List prices get all the attention, but they don't really tell the full story. The real cost to patients is opaque to even the most seasoned health policy experts such as yourselves, and might as well be a foreign language to patients. We deserve and we ought to demand transparency through the entire drug supply chain, the manufacturing process, the R&D, and the rest of the entire healthcare system. That includes the true prices other stakeholders pay and charge for the healthcare they provide. The rebates thrown around the system to hide the truth need to be presented as well. Hospitals, device companies, doctors, pharmacy benefit managers, insurers, transportation providers, billing managers, everyone needs to provide transparency and accountability. And yes, drug companies need to be held accountable too for their role in our increasing costs and the massive spikes in drug prices. We shouldn't allow companies to abruptly raise the price of a drug when that drug has been on the market for years, especially when there's been no innovation, no R&D to justify a new price for an existing medicine. Bad actors that hinder competition shouldn't be able to delay patient access to generic and biosimilar medicines by slowing down the generic approval process. And it's of course understandable that these companies want to reap a profit from their innovation. However, it's unjustifiable to cut off patients from the care they so much deserve. I believe we can find a balance between protecting IP and access to care. We can start by maintaining rational IP standards, ending market abuses, and providing more innovation and competition. And with that, I'd like to focus my time on how certain pharmaceutical companies are gaming our patent system to prevent competition and maintain high prices. Dr. Kesselheim, I know you have a lot of experience in this area, and I'm hopeful that we can get from you testimony on specific companies, specific examples where we have seen a specific drug or a specific company gaming the patent process to extend their control and opportunity to really gouge the public to make these types of profits that we're so concerned about.
Sure, and I've provided a